This is Emma Cluck recording.
My name is Hannah Ellis. I will be performing the IV insertion on Jennifer Doe. She has no known allergies, but she does have an order for IV insertion in her left antecubital to start some IV fluids to hydrate her. So before I enter the room, I'm going to wash my hands. I've already gathered all of my supplies. So I'm going to provide for privacy. Hi Jennifer, my name is Hannah. I will be your student nurse today. I see that you have an order for IV insertion. Do you have any allergies that you know of? No? Okay. And then if I could just have you state your name and date of birth. Jennifer Doe, 11/5/75. Perfect. All right. So, and which arm is your dominant arm? Your right arm? Perfect. So we are going to go into your left arm just so you have more mobility. And have you had any mastectomies or with lymph node removal or a fistula at all in this arm? No. Okay, perfect. So I'm just going to take a look-sees here. I'm going to apply this tourniquet. Going to be a little bit of a pinch. I'm just going to check out your veins here. All right, so I see your antecubital looks really good. Nice and hydrated, distal to your joints and easily palpable. I don't feel any valves or anything, so we will use that vein. If I was having a hard time finding a vein, I would have you squeeze your arm, or I would apply a warm compress, or just help by tapping. And for elderly clients, a lifespan consideration is sometimes they're a little bit more dehydrated, their veins are rollier, so we would have to probably use all of those interventions in order to comfortably insert an IV. So I'm going to wash my hands one more time here. So Jennifer understands what's going on. You've had an IV before, correct? Yes. So no surprises here, just the same poke, and everything should go smoothly. I am going to start prepping my stuff over here so everything can happen swiftly. I'm going to put on some gloves. Alright, so to make sure everything is prepped, I have made sure that my dressing is labeled, so I have my initials and today's date, so that's all ready to go. This is fresh out of the package. This is my saline lock. I am going to clean the tip of this just to make sure everything is clean for 15 to 30 seconds here. Perfect. I'll take my saline. There's no air bubbles. I have let this dry, and I'm now going to insert in. Make sure this is all good. Now I'm going to unlock the lock of it, and then I would just flush. Make sure there's no air bubbles and everything is set. I'm going to put this back here. Make sure it stays nice and clean. That's all ready to go. I have my Tegaderm ready to go, and I'm going to have 2 pieces of tape just to make sure everything is stabilized. Perfect. All right, Jennifer, so now I'm going to take this alcohol wipe, and I'm just going to clean your arm up really good. I'm going to apply this tourniquet one more time, and I would only leave it on for 2 minutes max. I don't want to disrupt any arterial blood flow. So a little bit of a pinch there, but it won't last too long. So I am going to start in the middle and clean in circular motion for 15 to 30 seconds. Make sure this is all clean where my Tegaderm will be. All right. Now that's gonna dry for me. Gonna get this all ready to go. I'm gonna have this gauze nearby also in case there is any blood that flows out that I need to clean up. All right, now that that is dry, I am going to take my needle out like so. All right, Jennifer, a little bit of a pinch here. I'm going to pull down, taut on the skin, bevel up. I am going to insert, and I have reached blood flow. So I'm going to insert about a 1/2 centimeter more. And then I'm going to slowly move this up. And I'm going to be ready to go here now. And parallel with the skin, I'm going to pull this out. I would inject the safety needle, but for video purposes, I will not. And I would put that in the sharps immediately. Now to make sure my line is patent, I am going to flush, and everything is flowing nicely. Everything looks good. Now I'm going to just kind of clean around here. Jennifer, still doing okay? Good. All right, so this would be in my sharps. Alrighty, perfect. So I'm gonna hold that there. Now I will take my Tegaderm. Going to go just like that. And I have my label there. Let me get this off. It's being a little difficult. There we go. Alright, so I would make sure all of this was off. And then I have my label. Just gonna put this right there. And then I have my 2 pieces of tape. So to make sure that this is stabilized nicely, I would go like this. Do a little cross around. And then I'm gonna flush the second. Lock. Unhook. And then I'll take this one more time. Make sure it stays so that the IV doesn't come out. And depending on my agency's protocol, I would saline flush this IV every 8 hours as needed to make sure that it is patent and there are no blood clots. So everything is good. Jennifer is comfortable. She understands what is going on and what happened. I will take my gloves off, tourniquet off. I would change this pad out because I did leak a little bit of blood. I'm going to wash my hands. And I would make sure that Jennifer is comfortable and safe with her collet and reach. And I would document that I did insert a 20 gauge needle, IV needle into Jennifer's left antecubital at approximately 8:11 p.m. on August 30th. It took me 1 attempt. I did inject about 7 mils of normal saline to saline lock the IV, and she handled it like a king. And everything went smoothly.